Hey everyone, Dr. Eric, your fitness physician and peptide doc here to talk to you today about some lab tests. I'm doing a quick grease board, whiteboard talk on lab testing. A lot of people ask me, what labs do I get? What do I order? Obviously, once again, you want to make sure you go through a physician. And obviously, a lot of people recommend things online and different things, and that's great, but make sure you go see a qualified age management physician who knows what they're doing, knows more importantly how to interpret these in correlation with a clinical scenario. In other words, a patient interview, face to face. There's nothing that beats that. Talking to a patient, understanding them, what's going on with them, their symptoms. There's the art of medicine, and that's extremely important. It takes a lot of training, a lot of practice, and I'm still working at it myself. So basically, I'm going to focus on men, but obviously we'll talk about women a little bit as well. But bottom line is, again, a history and physical is the most important thing. But I want to do a baseline hormonal and laboratory analysis on most of my patients. We can start with a basic panel and go all the way to more of a complex panel depending on their health. Obviously, if they have other health issues, they're really overweight, have high blood pressure, diabetes, or other health issues, we're going to dive into it and go a little bit deeper. We can often start with a basic panel for someone who's generally healthy and really wants to address their hormones, and that's what we're all about, right? We want to dig into things and see what we can correct. So one of the first ones we always do on most people is a basic CBC. It's a complete blood count. It looks at your red blood cells, your white blood cells. Now, you usually get a differential. There's a lot of cool things you can do with that, looking at the different fractionations like the monocytes, the eosinophils, and the basophils, different ratios that I can look at to help to determine if there's any inflammation or there's other issues going on, allergies, neuroinflammation, things of that nature. But it's just a general screen to make sure there's no problems with anemia or anything that would indicate that there could be something going on, like some type of megaloblastic anemia or an iron deficiency anemia. It's something that would indicate or clue me in about a B12 or a folate deficiency, things of this nature. But the most important thing, again, is most people are asking about anemia. Once they're on therapy, it's something we follow as well. There's a lot of people talking, they're always concerned about blood counts going high, especially when you're on testosterone therapy. And it's actually more of an erythrocytosis, not polycythemia vera, which is another clinical oncologic condition, which is completely separate. And again, as long as your hemoglobin and hematocrit are less than 18, roughly around 18 and 54, 55, somewhere in that range is totally fine. I've never had any guys reach that level as long as you're dosing them appropriately. People that are doing super therapeutic dosages, then they tend to have problems. But I've never had to send anybody to get blood drawn or anything like that. If you do it right, you're never going to have a problem with that. Basic Chem 12 panel is going to look at all your basic chemistries, your liver function, your kidney function, your electrolytes, things of that nature. Very important to get a baseline screening evaluation for that. Cortisol, obviously everybody knows about cortisol. It's better to get a 24-hour screen either through saliva or urine. That's the most accurate. It looks at cortisol as well as cortisol metabolites. I use the Dutch test and a few other different tests like for that as well. But a baseline single serum test on a cortisol isn't a bad idea to get. Again, it's a snapshot. It may or may not be extremely accurate, but if it's really high or really low, that can clue me in a little bit as well. So something good to get if you're going to be grabbing this panel. Of course, we get a total and a free testosterone. I'll talk a little bit more about how to break this down. Unfortunately, there's a ton of lab variation from lab to lab, person to person, not extremely accurate. That's why, again, you go by the clinical condition, you go by the symptoms and how the patient responds to therapy. But I do use them as a rough guide. We want to look at the total and the free because both are important. And we'll talk in future videos about differentiating these and things that are adjusted. A lot of people want to quote-unquote free up their free T by messing with their ASHBG and different things like that, and there's pros and cons to that, and I'll talk about that. Estradiol, very important in men and women. Men need estrogen too, again, a topic for another day, but a lot of the benefits that men get with testosterone therapy actually come from estrogen. A lot of the libido, bone health effects, things of this nature. The fat burning effects, believe it or not, comes from estrogen. Estrogen is not the devil, like a lot of people have always said for years and years. I think that's coming around. So again, you want them not too high, not too low, but in that sweet spot. So a lot of my guys are walking around with estrogens, in the high 20s all the way up to the 50s, and that's totally fine. If they're asymptomatic and they're doing fine, I don't mess with it. I had one that was over 60 one time, and again, no problem. As long as they're feeling good, no problems. Everything else is on par, not a problem. LH and FSH indicate your hypothalamic and pituitary function. They're what stimulate your ovaries and your testicles to produce your sex hormones. So again, that can clue me if they're really high, they're really low, and not only at the beginning of therapy, but at the end of therapy as well.